Tolnaftate is a medication that is used to treat skin infections like athlete's foot, jock itch, and ringworm. It is an antifungal that works by stopping the growth of fungus. In some cases, Tolnaftate can also be used to prevent athlete's foot from returning. It is important to use this medication as directed by your doctor. The usual dosage is applying a thin layer of the solution to the affected area once or twice a day. It is best to apply it at the same time each day to help you remember. Be sure to continue using Tolnaftate for the full treatment time recommended by your doctor to ensure the infection is completely cleared up. Now, let's talk about how to use Tolnafi-Al 1% topical solution antifungals. This medication is for use on the skin only. Before applying, make sure to clean and thoroughly dry the area to be treated. The usual dosage is to apply it to the affected skin, usually twice a day or as directed by your doctor. The dosage and length of treatment will depend on the type of infection being treated. Some forms of Tolnaftate, such as powder, may need to be shaken before applying. Be sure to check your product package to see if your form of this medication needs to be shaken. Apply enough medication to cover the affected area and some of the surrounding skin, then wash your hands after applying. Do not wrap, cover, or bandage the area unless directed to do so by your doctor. It's important to use this medication regularly at the same time each day in order to get the most benefit from it. Also, continue to use this medication until the full prescribed amount is finished, even if your symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If you're using this medication for jock itch, make sure to tell your doctor if your condition lasts after 2 weeks of treatment. For athlete's foot or ringworm, let your doctor know if your condition lasts after 4 weeks of treatment or if it gets worse at any time. Remember, it's important to follow your doctor's instructions for the best results. If you experience irritation of the treated skin, it's important to notify your doctor or pharmacist immediately. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. Although rare, a very serious allergic reaction to this drug may occur. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Before using Tolnafi-Al 1% topical solution antifungals, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to disclose your medical history and inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. If you are pregnant, discuss the risks and benefits of using this medication with your doctor, as it should only be used if clearly needed during pregnancy. Additionally, it is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Tolnafi-Al 1% topical solution antifungals. If Tolnafi-Al 1% topical solution antifungals is swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the best possible outcome. Never share this medication with others. This medication has been prescribed specifically for your current condition. Do not use it for another infection unless directed by your doctor. If you forget to use this medication, apply it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and use the next dose at the usual time. Do not apply double the amount to make up for the missed dose. This product should be stored at room temperature and kept away from children and pets. It is important not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.